Often, when a loved one is diagnosed with a chronic condition, like cancer, we want to be a source of support, but we just don't know how. What questions do I ask? How can I support them? What do I even say? These questions are so common and a lot of times keep us from reaching out at all. So today, I'm here to give you 3 tips to help you get that conversation started. My first tip would be to start the conversation by asking questions. We all want to say the right things and ask the right questions, but that can be difficult if we're not really familiar with what our loved one's going through. In my experience, the best questions allow your loved one to lead this conversation. A good example of an opening question can be, I would love to support you right now. What's the best way I can do that? This lets your loved one tell you exactly what they need, and it takes out all the guesswork on your end. My second tip would be to stay away from expressions like don't cry or everything happens for a reason. I know these are well-meaning, but they really minimize the experience that your loved one is going through. Remember, the purpose of your conversations are to be a safe place for your loved one to express all of their emotions. And those emotions are commonly going to include sadness, anger, and frustration. Remind yourself that the best thing you can do is to just be present with your loved one. And if you're having trouble being present or sitting in the silence, as I call it, remember your intentions. You're there to understand what your loved one is going through and to provide a safe space for them to share all of their experiences. My third and final tip is to share resources for support. Your loved one and you aren't going to have every answer to every question, and that is okay. Look to the experts in your community and learn from them. Medical City Healthcare and Sarah Cannon have this wonderful resource for our cancer patients called Ask Sarah. It's a toll-free hotline staffed by oncology nurses 24 hours a day. Ask Sarah nurses are available to answer any cancer-related question, and then they also will give you resources in your community to provide support. All calls are confidential and they are all at no cost to you or your loved one. I hope this information and all of these tips have helped you get the conversation started in your life. Thank you so much for your time.